What happens when the stress is high? I'm at work. It's got to be perfect, right? You need to be always on because you don't want anybody to get injured, to be unsafe, because you're working on people's health on a daily basis. You have to be accurate all the time.
So what do we do to battle those things in the moment?
You're not trying to ignore the emotion that's come up, because that emotion, if you ignore it, it gets stored and it's going to come out somewhere else and you're not going to like it. It can surface in all kinds of health problems. It can become chronic conditions because you're storing stress. That's not good for how your body's going to function.
How easy is it to put things out of your mind, maybe whenever they're still troubling you?
You know, I've always had just one goal for Dental Assistant Nation, and that was to reach as many dental assistants around the world as I possibly could. So thank you for being a part of the community, and I want to make sure that you have hit the subscribe button so that you can not only help us spread the message and we can grow our reach, but also to make sure that you are getting the latest episodes delivered right to you the moment that we drop them. We are all about dental assistant education and empowerment here at Dental Assistant Nation, and we want to make sure that we are reaching as many dental assistants as possible. So thank you in advance, not only for being a part of this community, but for helping us spread the word.
Hey everyone, it is Kevin Henry, founder of Dental Assistant Nation. I am so glad you've joined us for today's episode. It's one that I've been excited about for a long time because we are going to bring on Wendy Ernzen. And Wendy is somebody that I've gotten to know and somebody that I believe has a great message for dental assistants. One of the biggest things that I know from talking to so many of you dental assistants out there is that stress is at a very high level. Burnout is at a very high level. So what do we do to battle those things in the moment? What do we do to try to unplug whenever we feel like the pressure is getting too much and we feel like that we're getting close to kind of blowing our gaskets a little bit? Well, that's why I brought Wendy on, because she's got a great philosophy on what can be done in the moment, as well as to make sure that we don't reach that boiling point. Dental assistants, this one is just for you. And so now I want to bring on Wendy Ernzen, and I want to thank Care Credit for being the sponsor of this podcast. And I just want to remind you that Care Credit is such a valuable resource for your patients. It is a resource that my mom recently used to be able to afford the dentistry that she needed. So I can tell you firsthand the impact that Care Credit has on your patients. And they work so closely with dental assistants because you all are so close to that patient journey and to making sure that they actually accept the treatment that they need. So if you want to know more about Care Credit in your practice, it's really easy. Drop me an email at kevin@kevinspeaksdental.com, and I'm going to send you the information to make sure that your practice is not only using Care Credit, but it's also using it to its fullest potential if you've already got it in your practice. And now I'm going to bring on Wendy Ernzen. Hey, Wendy, how are you?
Well, thank you so much for having me on the show today. Again, my name is Wendy Ernzen, and I am a caregiver, a storyteller. I'm also a fund development advisor professionally, and everything I am involved with comes from my own lived experience. I'm also the parent of an adult daughter with profound autism, and for those in the audience who don't know what that means that she requires 24/7 support. So for many years, I put everyone else, first while putting my own health on hold because of the care that she requires. So I'm here today because I understand that dental assistants also sometimes live in a pattern that I know very well, which is like you're doing this amazing, skilled, essential work. You support patients, dentists, and teams. You're managing all these people, this time, this pressure and precision. And quite honestly, you're probably doing it while you're ignoring your own body, so whether it be pain, stress, or fatigue. So, I know that that's something I've experienced in my life, pushing through just because it's part of what you think you should do because you're being responsible, and telling myself that I could rest later. And what I've learned is that doing that, caring professions don't necessarily burn people out because of lack of dedication. It's because they are just expecting so much, right? They're expecting so much of themselves. So that's why I wanted to come on the show today. I wanted to talk about not only my experience, but hopefully some things I thought might help you in your role as a dental assistant.
Really appreciate that.
So that leads me to I needed to start thinking about my health differently because, again, it was just so hard on my body and my mind. And so I stopped thinking in terms of, I know we always talk a lot about self-care, right? So like all the cool self-care things you can do. But the thing is that I find is that when you think about self-care and talk about it in that way, it can almost be perceived as extra. And it's not extra. It's actually, to me, foundational support that you need, whether that be on a daily, whatever your regular basis is. And so for me, I have what I call my big rocks, which are like my foundational pieces that I do. And then I've got these things that I call Pebble moments. And that's for like when I'm feeling like really stressed in the moments, a few quick things that I could do. So for foundation, or for big rocks rather, again, this is like foundational support. So for me, that might mean like, for example, I do meditation every day. That makes me feel good. It makes me feel grounded. I also do regular exercise. I'm walking, like here in Michigan, it is, I think yesterday was probably about 15, maybe 20 degrees with lots of snow. I just bundled up and walked outside because otherwise you're going to be stuck inside all the time. And I'm like, no. So it's important for me, no matter what, every day to get outside and walk. And then, of course, I'm a lady of a certain age. So I also do weights and a few other things. But my point is it's regular. It's whatever works for you, though. And I say this because I have another daughter and they were feeling some anxiousness and anxiety about college. And I was like, well, you need your big rocks, blah, blah. And they're like, I don't want to do any of that stuff. I don't meditate. I don't want to do any of that stuff. I said, okay, guess what? Maybe your big rocks are different than mine. So they had to think about what works for them. So for them, they love to do songwriting and they play guitar and they do some other artistic stuff. And that fills their cup. That makes them feel good. And so they have a different list than I do. So even though I'm saying my list are things like meditation, exercise, sleep routines, things like that, that doesn't mean they're yours. So it's just about basically, I like to say, trying different things out for a period of time to really understand and being honest, how does your body feel better? Is your body feeling better by doing those things? But though, again, those things could be sleep routines, like going to bed at the same time, getting up at the same time, low alcohol, nourishing food. And I say food for me is so important because, first of all, I love food. So we'll just start there. Who doesn't love food, right? But I also realized that, eating food out, I don't know how they're making that food. So I had to start really cooking a lot of my own food. And for some of you might be like, I don't have time for that. And I respect that. So what I will say is, you probably have heard terms like food prep. Okay, so that might be something you could do on the weekends, right? You could prep meals. You could make, what I often do is I'll make food for 8, even though it's just my husband and I, and then I freeze stuff. So you could do that. And there's also these really cool apps now. I don't know if you've ever used like an Instacart or something like that, but now there's apps that even work a step before that. And you can select all of your recipes, populate your grocery list, and either A, you can show up and shop, or B, you can order from Instacart or something like that. So then all the food just comes to you. So it's really just about you cooking. So that can help you plan easy recipes and food. So that way you can get, again, nourishment instead of paying there's some great apps too that prep food like Hungry Root or something like that. But if you really want to be in control of your own food, those are some little tips that you can pursue. The other thing that for me that I haven't pursued as much, but I'm still leaning into a little bit more, is also a spiritual practice. For some people, church is a really supportive thing to go to on the weekends, or your synagogue, or wherever your place of worship is. Might be Buddhist readings, whatever. I don't know. Sky's the limit, right? But it's just whatever feels and resonates with you. And of course, I said earlier, and maybe I said this earlier, but if not, the other thing is about setting those clear boundaries. So those are like some foundational things, right, that you can think about. But then you're probably like, well, Wendy, that's cute. But what happens when the stress is high? I'm at work. It's got to be perfect, right? You need to be always on because you don't want anybody to get injured, to be unsafe, because you're working on people's health on a daily basis. You have to be accurate all the time. So for me, then it's about finding those 5 minutes. So what can you do in 5 minutes? So it could be something simple. You could be like, I'm just going to step outside for 5 minutes and actually be in the sunlight. Okay, that could be one thing. You could do things like box breathing. So box breathing is like a technique where you breathe in for 4 breaths, you hold for 4 breaths, you breathe out for 4 breaths, you hold for 4 breaths. And you do that for maybe like 3 or 4 repetitions. That helps to bring down the nervousness and actually to stimulate your parasympathetic system. So you could do something like that. You could do a short meditation, the Calm app, which I'm not saying you have to get all these apps, but I use a lot of apps. So, and let's be honest, we're all a little attached to our phones. So the Calm app is the one I use, but they have very short meditations. So you could do a 5-minute meditation, just put your headphones on and go into a room and just do that. You could simply just write down one thing you're proud of, one thing you're grateful for, have a little notebook and just be honest though, and be in that moment when you're doing that. You could make a cup of tea. So it's about finding those things that work for you. I have a list. I'm looking at it right now. I have a list of about 20 things. And so the point is that you want to do that list before you're stressed, right? So that when you just look at that and say, what feels good right now? Boom, I'm going to do that one. And sometimes it works. Sometimes it doesn't. But I find just like anything else, it's about, I want to say training yourself, but you want to get your body used to it. So you got to do it more and more and more often. And then all of a sudden your body just kind of goes, oh yeah, that's right. I feel that. So those are so those are the things that I like to think about when I think about those foundational things, which are those big rocks. And then of course, finding that space for those pebble moments.
How easy is it to put things out of your mind, maybe whenever they're still troubling you?
So Kevin, that's a good question. So how do I put what's on my mind and perhaps what's troubling me out of my mind? Well, that is a good question. This goes back to, honestly, my meditation practice. And it doesn't always work, so I'm just going to be honest, because I'm a human being and I have lots of things that run through my mind. But when something is really troubling me, it is about sitting there and doing, when I say meditation, because you're breathing, and the whole point is that you're checking in with your body. So you're not trying to ignore the emotion that's come up, right? Because that emotion, if you ignore it, it gets stored and it's going to come out somewhere else and you're not going to like it. So I say in that moment, do you want to give space for that? I'm angry. I'm stressed. I am fearful. I don't know what the emotion is that you're necessarily experiencing that time, but you're literally sitting with it. You're sitting with it in that moment and you're giving it that space so that it can crest and come back down. And then in that moment, maybe you can find some space and clarity of how you actually want to move forward next. That's what I try to do because I found, again, for 20 years when I was being hyper vigilant with my daughter, I was doing this fun thing called dissociation. And that's where you just kind of push everything to the back burner. And I can tell you right now, eventually it will bubble up. It can bubble up in some pretty extreme things like panic attacks. But my point is that it can surface in all kinds of health problems. It can become chronic conditions because you're storing stress and all your body gets really tight. And that's not good for how your body's going to function. So that's why I'm saying that if you can, as much as you can, spend that emotion in the moment that you have it. If you're sad, cry. If you're angry, let it just pulse through you, whatever it is.
The Chicago Midwinter Meeting. It's one of the biggest meetings in the dental industry every year, and this year is going to be extra special because I'm going to be talking to dental assistants at the meeting, and I can't wait to be a part of it. So dental assistants and dental team members, join me Friday, February 20th, as we talk about harnessing the powers of personalities in the dental practice. Why can't we all just get along? We're going to talk about that. And then Saturday, February 21st, it's going to be extra special because dental assistants, this one's just for you as we talk about battling and beating the demons of dental assisting. So join me at the 2026 Chicago Midwinter Meeting. I can't wait to see you in the Windy City.
And so if people want to get a hold of you, how's the best way?
Yeah. So if anybody would like to reach out and learn more, so whether it be, just you want to chat more about this, or you want to learn more about Let's Plant Houses, because that's actually the podcast that I do. And for those of you who are wondering, so Let's Plant Houses is a podcast where I get to celebrate parents who have intellectual or developmental disability. They have a child with intellectual or developmental disability similar to mine. So it could be autism, cerebral palsy, it could be Down syndrome, many things. But it's about celebrating their stories and their lived experiences. So it could be parents or adult siblings, because sometimes adult siblings also have a lot to share as well. And so with that being said, if you know of anybody who wants to listen to that kind of those stories, I would love that too. You can find me on LinkedIn for Wendy Ernzen. Feel free to reach out and contact me there. That's ERNZEN. And yeah, I'd love to hear from you.
Thank you so much for being on today. Really appreciate it. And I know what you've given. So it's been some great information for our dental assistants.
It's been a pleasure. And I'm sorry that we had some technical difficulties, but I know you're going to make this amazing, Kevin. So I'm not worried.
I have amazing assistants who will do just that.
Hold on. I'm going to take one quick photo of us because I want to use this for later.
Yeah, please. I am so appreciative to Wendy and all the great thoughts that she just shared on the podcast. And dental assistants, that was just for you. That was because I've heard from so many of you that this is an issue that you're facing. It's how to separate from the moment, how to make sure that you are using apps to help, how you are trying to step out or step away whenever the stress gets too much, whatever that might be. And remember, it's always okay to say, I'm feeling under stress. I am feeling overwhelmed. I'm feeling like I need some help. It's okay to admit that. And so I want to make sure that, first of all, you know that. And second of all, that you get the help that you need if you're reaching that point. Because the one thing that we don't need, above and everything, dental assistant, great. But I'm talking human beings right now. The one thing that we don't need are you as a human being reaching the point where you don't feel like you can cope with what's going on around you. So absolutely, please seek the help that you need and ask for the help that you need, and tell others that you're struggling with something right now. Open up. Don't share that journey alone. So again, I want to thank Wendy for being on. I want to thank all of you for listening. I want to thank Care Credit for being a sponsor. And again, drop me an email at kevin@kevinspeaksdental.com to learn how Care Credit can work more with your practice and you as a dental assistant. Happy to share that information with you. Till next time, it is Kevin Henry, the founder of Dental Assistant Nation, signing off, and as always, wishing you nothing but success ahead.